So I just want to talk a little bit about how to spot when things don't feel right, if things have gone wrong. Quite obviously, your body and your digestive system is very different, so the pure fact that you had the surgery is going to not feel right for the first few weeks. But what I'm talking about is things that are worrying, that we would want you to come back and see a health professional about. You will have been given a contact number and contact details for the nurse specialist, for the dietetic team, for the ward that you've been discharged from. The one thing that I would say is, if you get any sort of abdominal pain immediately after eating, the chances are you've eaten too quickly, and this pain will pass. What I would say to you is, if the pain is severe and it doesn't pass within an hour or so, get on the phone and make a phone call. And it might just be that you need a little bit of reassurance at the end of the phone line. Obviously, you've had surgery, we've made an incision or several incisions in your skin. You need to know how to spot an infection, a localised infection in the skin. So the wounds for the first few days will be covered. And then after 48 hours, 2 or 3 days, you can take the dressings from the wound. Most of the time, the wounds are closed with absorbable stitches, so you don't need to worry about having anything removed. They will look a little bit bruised, a little bit red, but that's only for the first few days. If you get to the end of the first week and the wounds feel warm and they're very, very red and swollen and they feel hard, or there might be yellow pus seeping out of them, then that's the time to think that you may have a generalised infection. Again, get on the phone, but the thing that you need for that is antibiotics. So we would advise you to go and see your local doctor or GP for that. It is quite common, unfortunately, but it's very easily solved with a course of antibiotics if it's spotted early. The next thing that you maybe need to be a little bit worried about, as you know, the risks for surgery are of leaks in the staple line or bleeding in the staple line. If this does happen, you will feel generally unwell. You'll have a high temperature, you will have pain, you won't be able to tolerate any sort of liquid or food, and you will just feel generally unwell, more unwell than the normal post-op sort of tiredness and lack of energy. Again, get on the phone to the nurse specialist, to your doctor, but if you feel really, really unwell, you go to your local A&E or emergency department. Tell them the surgery that you've had done, and they will make sure that the relevant specialists come to see you. It's very, very important that you don't sit on anything. The only thing that I would say, give a little bit of time to, as I've said, is if you've eaten something and immediately after you get a tightness in your tummy, it could just be that you've overdone it, but this feeling should pass. But if you're worried at all, nobody's going to punish you for getting on the phone and asking the question. It's absolutely fine, that's what we're here for.